people talk about the two canoes. You have value-based care, you have fee for service. People like to have these discussions, hey, we're still heavily fee for service, we can't do value, or we're going to go all in on value. I look at it as what's the ideal clinical care model? So how do we take care of people? Again, how do you keep them healthy? And what does that look like? And that works both in fee for service and in value-based care.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where leaders seek to solve big problems and transform healthcare. Join us for conversations to hear how their vision and bold moonshots are becoming reality.
Welcome to A&M's What's Your Moonshot podcast series. I'm Travis Sherman, a senior director with Alvarez & Marsal's Healthcare Industry Group. I'm joined by my co-host, Seth Ciabotti, managing director in A&M's Healthcare Industry Group. Today, we're pleased to welcome Dr. Nari Heshmati, Chief Clinical Officer at Lee Health. Nari, thanks for joining us. We're looking forward to a great discussion.
Thanks for having me. Glad to be on.
Yeah, we've been looking forward to it now. I know we were trying to get this on the books for a while. So this should be an exciting episode. So let's start right in with the questions. So, Nari, you described your moonshot as transforming growth into a truly integrated health system. Can you unpack that a little bit for us? So, what does that moonshot look like in practice, and why is it so hard to achieve?
Yeah. So, if you think about it, you'll have healthcare systems. They're going to talk about, well, I wanted to be the best place for cardiology, or I wanted to be the best place for neurosurgery. Or you might have somebody who says, I want to do chronic disease management programs, or we're going to be really good at keeping people healthy, or doing fee for service, or doing value-based care. What I want is how you bring all the pieces together, all the resources that a large integrated system that does high level care, high value care that can put together, and how do you make it seamless for a patient to get through? And the example I would give you is, here at Lee Health, we took a look and said, how many of our diabetic patients are poorly controlled? A hemoglobin A1C, pick a number above 8.5. And that number was a lot, despite having phenomenal primary care docs, despite having dietitians, endocrinologists, having clinical pharmacists who could manage that. And so, why it's important is because we want to ensure we're keeping people healthy, but we're also providing that care when people are sick. And so we developed a program, we called it Diabetes Care Journey, and we put all those pieces together. And so now that patient flows seamlessly. They don't have to go search, they don't have to go pick. What am I supposed to do? We've got a program. We teach them how to eat. We teach them how to cook. We manage their medications if they need it. What we've done is we've reduced the hemoglobin A1C by 1.5 to 2 points with that program. What does that translate to? Maybe 2, 3 extra years of life, 3 extra holidays with somebody's family. That's what an integrated system can do. It can take those resources and it can truly leverage them, and it can make it easy because healthcare is hard to navigate.
Nari, that's incredibly insightful and also inspiring, just how you've been able to balance the pressures of fee-for-service as well as responding to patients' needs for health management. One of the things we want to ask more about is recognizing that health systems like Lee Health have grown rapidly in recent years. How do you handle integration with the demand for scale and achieving this ambitious vision with the need for partnerships?
Yeah, that is really hard. And so if you think about it, whether you are adding clinicians one by one because you're hiring them, recruiting them, or whether you're doing an acquisition, you're bringing in people. And, how do you get them to buy into this team-based care approach? How do you get them to be part of a system versus a standalone entity? And we had to face those challenges. We're up to about 1,350 clinicians. Down the road, we'll probably be 15, 1,600 when we get to where we need to be. We have doubled in size in 5 years. And so we had to go from, pulmonary practices. We had 3 pulmonary sites, phenomenal docs who had come to us, a combination of employed over the years and acquired practices. We didn't want to just provide great individual care. We wanted to leverage and bring all 3 of those sites together so that no matter which site you went to, we provided the same level of care. In fact, if you called site A and site A was busy, we wanted you to be able to go to site B, but not that you had to ask, that we offered it. And then we wanted to leverage that to be able to truly change outcomes. So what does that look like? We started a lung nodule program. And so you have incidental lung nodules. You go get a CT scan or something else, they find a lung nodule. Well, that scares you. Is this a cancer? Is it not? I want to get an answer. You might be driving a far distance to go to an academic center to get that addressed. Well, we took Everybody who had the skill set to do that, the robotic ion machine, we put it up into a lung nodule clinic. We had a standard process follow up and everything. We've done 2,000 cases now in that since we started that program a year ago. You have a lung nodule on our system, within 7 days, we can get you biopsied. Heaven forbid it's something bad, we can get you to a thoracic surgeon very, very rapidly. So that's the challenge you have when you acquire and you bring these groups in. And you've got to make sure you're getting the right people. You have to make sure that they are on board with providing care as a team, which is very different than what you might individually do. And you can also learn from each other. With each of these acquisitions, sometimes we adapt some of our model because there are things that are really good for patient care that somebody may have figured out in an individual practice or where they trained or something else that we can incorporate it in. So it's two ways, but you've got to have a focus on that versus a focus solely on growth.
Nari, there's a lot of health systems that are not at that level of integration after this, exceptional growth that's happened, right? So, what's a fundamental change? And you alluded to this a little bit. What's a fundamental change of how your teams, both clinically and operationally, how do they work in order to make that real, make that integration reality, or get towards that journey of making it a reality?
Yeah. I think first off, you have to commit that you're going to take care of the patient, make it seamless, and that we are a team. All the resources within the team are available for whatever's going to come up with the best outcome. The other thing is you got to move away from healthcare is always really siloed. So again, you might have a division that does something really well, and then you have another division here that does something really well, and they don't talk to each other. So patients bounce around. Hey, you know what? I've got a headache. Is it something bad? Do I see the neurosurgeon? Do I first go see my primary care doc? No, 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 the neurologist. But there's a way to go do that. You've got to integrate and make that all easy to navigate. And one of the big things when we approach this is we approach from the idea of you can and you will make it easy. You can and you will improve the outcomes. So when we start these meetings, what I tell people is what I don't ever want to hear is the barriers that we can't do it. What I want to hear is about how do we do it. So that diabetes care journey, we could have very easily sat down and said, well, primary care should be able to handle this. Why would they need somebody else? Or, well, what? We have endocrinologists. Let them figure this out. And you know what? If a patient needs more, they can call the dietitian. And, the clinical pharmacist, we could come up with 1,000 reasons why we couldn't come and do something well. If you are a high value integrated healthcare system, what you're actually approaching this by is saying, I can do this. Let's talk about the different ways we can do this effectively.
Earlier in your response, you used the word, how do we make it easy? Which really struck me. We wanted to ask a little bit more about at Lee Health. How do you think about access? And
Yeah.
in what ways are you enhancing access to ensure this experience is coordinated across the enterprise?
Yeah. For me, when I think about access, I think about how do I keep you healthy if you're healthy? And then how do I make you healthy if you're sick? And what are the different modalities and ways we can do that? So it's just not a brick and mortar visit. It's also having virtual. It's potentially having an e-visit. What if it's asynchronous messaging back and forth? Maybe it's services that we can provide. You know, being able to do the right side of service. Maybe it's integrating with all these different specialties and things that we've got. How do you put all those pieces together to make it work? And why I say that it's important for it to be easy. Healthcare is not easy. People call, we track how long when somebody calls, how long does it take us to answer the phone? But not only do we answer the phone, let's say we have to transfer it. Let's not just tell the person call a different department, it's not my problem. We'll do a warm transfer. How do we make sure we connect all those pieces? Because it is confusing. Even when we ourselves need healthcare, we walk through it and, it's hard to navigate. So you want to make that really, really simple. You also have to have the data to do it. So, yeah, you've got to track how long does it take to answer the phone? How long does it take to get somebody a solution? How long is your next available appointment? If you are available but I am booked, do you just offer me or do we offer you as an option? If we have a chronic care disease management program, how do we identify the right patients? How do we offer that in them? How do we look at the outcomes we're getting? So it's not just putting somebody into these programs, it's making sure it improves their outcomes and their health. That requires a lot of infrastructure to make it easy. And so, I kid around. It should be hard for us. It should be easy for you.
So you do make it sound easy, Nari, the access question and journey. And I have to tell you, it is not easy. Now, just like you said, just to get an appointment and just to answer the phone, you'd be surprised that that is a task these days in healthcare. So you've talked a little bit about how you're aligning specialties and staff and sites in the integration journey. What about payment models? How was that impacted?
Yeah, it's always people talk about the two canoes. You have value-based care, you have fee for service. People like to have these discussions, hey, we're still heavily fee for service, we can't do value, or we're going to go all in on value, we can't. I look at it as what's the ideal clinical care model? So how do we take care of people? Again, how do you keep them healthy? And what does that look like? And that works both in fee for service and in value-based care. So if I'm seeing people in a fee for service and they're a diabetic and I've got them in better control and they go get surgery with my orthopedic surgeon, guess what? Their outcomes are better. They spend less time in the hospital, less strain on the healthcare system. But now let's think, what if we were in a value-based care world? Well, that patient's gonna have a lower length of stay, lower downhill complications, lower healthcare costs, so it's gonna work. And so a lot of that is, what's our clinical care delivery model, and how do we make that so we're getting our best outcome? And yes, with each different model out there, there are gonna be rules, there are gonna be check boxes, there are gonna be things. You've gotta have the expertise to be able to do that so that you're economically sustainable, but at its core, you're doing the same thing. You're providing high value healthcare to the community.
Wonderful. We appreciate that, Nari. So I'll move us to our last question. As you've been on this journey, I'm sure there's been both wins and hard lessons learned. As you look 3 to 5 years ahead into the future, what does success look like? And what advice would you give others that are on a similar transformation?
Yeah, yeah. Again, we're up to 1,350 clinicians. We've been able to recruit amazing talent. There's a handful of cardiac surgeons out there in the country that can do a robotic mitral valve surgery. We have one of them. But we also are the safety net for our community. We're also doing GME and advanced teaching. So that's been our journey. Where do I see us in 3 to 5 years? I see us being that safety net for the community, but also providing the highest level of care that you would go to a tertiary care center, and also teaching the next generation of clinicians how to do that and succeeding both in fee for service, in value based care, in whatever modality, because we've got the right clinical care model and it's easy to come see us. Now, what did we learn and what advice would I give? It's not easy. You've got to commit to it because it's really easy to fall into your default. It's really easy to be, you know what, that had some challenges because you'll roll out a program and it's going to be hard. Maybe the tech connection doesn't work when you do it. Maybe patients don't enroll in it. Maybe your specialists don't want to do it or your primary care docs don't want to refer to it. There will always be hiccups. Approach it from how do we take care of people? Approach it with the attitude that it can be done. Use the data, use the technology, look at your outcomes, and then circle back, and you'll get through it. You'll get through it. Your clinicians will be happier, your system will be stronger, and your patients will love you for it.
Well, Nari, this has been a great discussion. And just just thinking of the word integration and the other words that are bounced around in healthcare these days. You hear transformation and innovation. And I think, before you get to those two, I think you have to integrate these systems that have grown. I think the core value is integration, and what Lee Health has done and what you've done. It's extremely impressive. And I'm sure other leaders across the country would be are very interested in this episode and hearing more from you. And so thank you for joining us today.
Thanks for having me.
Yeah. Thanks so much, Nari. We appreciate your leadership and you sharing.
Alvarez and Marcel. Leadership, action, results.